Hi, welcome to NHC Greenville. As a private duty sitter or nurse, we want you to know that we're excited about having you as part of our team as we work together to provide great care for our patients. At our center, we want to make sure that we set you up for success, and by doing that, we want to cover a few items that we find to be very important and very helpful for sitters or private duty nurses at our center. First of all, we want you to know that communication is very important for us. And if we're going to provide great service to our customer, the patient and family, we want to open that communication line with you and let you know you're very much a part of our team as we work together. We also want you to know that we're a non-smoking facility, and there are certain state and federal regulations that are prohibitive of those types of behaviors. So please remember, if you're going to smoke, we have one smoking area to the rear of our building for staff and private duty personnel. We also have a no smoking policy period within the building for anybody, and especially the patient. We want to make sure that they do not have any cigarettes, lighters, or any smoking paraphernalia in the room at all for safety reasons. Also, some patients come in with special dietary needs. So again, for the protection of the patient, it's very important that you check with the charge nurse that's in charge of the patient you're caring for before you provide anything to eat or to drink to a patient that may have special dietary needs, again, for their protection. Also, if you have any concerns or problems within the center, again, our goal is to make sure that we keep an open communication line. So if you have concerns, please let us know about them, because if we don't know about them, obviously we can't fix them. Here at NHC Greenville, we keep promises to families, and our promise number 10 is to resolve any concerns. So if at any time you feel like you've got an issue with the patient you're caring for, let us know so that we can work to resolve that concern together before we have to involve the family. And lastly, we want, again, to provide great care and service, so we want to work with you to ensure great outcomes.
Hi, my name is Angie Youngblood, the Director of Social Services and Admissions Coordinator here at the Center. I want to take a few moments of your time and discuss patient rights as well as the abuse policy for our center. Patient rights, all of the patients upon admission receive a booklet of their patient rights, so they do have a copy in writing. But these go over briefly a right to have visitors. Patients can let people into their rooms at all hours of the night by giving them a code. The front doors do lock at 9 p.m., but they can enter and exit through the back entrance 24 hours a day. We do encourage visitors to respect the privacy of other patients that may be in the facility as well. So if there are too many people in a room or they are becoming a little too loud, we do have that right to ask them to come back and visit at a later time. Also, patients have the right to be involved in a care plan meeting. Care plan meetings are every 90 days, and this is where we sit down with the family or the patient and discuss how the progress is going. And they can ask any questions that they may have at that time as well. They do have the right to choose their own physician. We do have 2 doctors groups that come into the facility at this time, but if they have a special physician that they would like to see, there's a process we would be happy to honor, but we need to speak with the patient and get some credentialing, those type things, from the physician prior to them coming to the facility. All patients have the right to look at their medical record. We can sit down with a patient and they can review the record in its entirety. Also, with conferring on medical records, you want to make sure that when we're providing direct care, and obviously this is pertaining to our direct caregivers, CNAs, nurses, when you're providing care, please refrain from talking about another patient while you're doing care services. They do have the right to privacy. On that, with privacy, we want to make sure that we're knocking on all doors as we enter, that we are pulling curtains and closing blinds when we're providing care, so they do have privacy rights as well. Patients can let us know of any treatments they may want, CPR, DNR, PEG tube feedings, and so that we can make sure that those requests are honored. And about the grievance procedure. A patient has a concern or complaint of any kind, we do encourage those patients to come to their social services department, or the director of nursing, or the administrator. If the concern still cannot be handled at this level, there are outside agencies that can come in and take care of those as well. All patients do have the right to request something else to eat. They have the right to send and receive mail. There are telephones on each of the nurses' stations. We don't have telephones inside the rooms. So all patients have the right to utilize those cordless phones, and we provide the privacy if they need that as well. This is a non-smoking facility, so patients cannot smoke in or on the grounds of the center. And all patients have the right to our DHEC survey results. We get surveyed once a year by Department of Health and Environmental Control. All of those survey results are posted at each of the day rooms in a notebook, so the patients can go and have free access to that as well. On abuse, there are several forms of abuse: physical, verbal, misappropriation of funds, sexual, emotional, and neglect. All patients have the right to be free from abuse. This center is a zero tolerance for abuse policy. So number one, if you see a patient that is being abused, one, remove that patient from danger. Number two, report the incident to your supervisor. Your supervisor, we will then begin an investigation, and if it's found that the concern is substantiated, that partner would be terminated from the facility. And also on neglect, especially, want to let you know, all partners have the responsibility to answer call lights. I don't have the same credentials as some of y'all do, but that is where, I want to make sure I go in and I may be able to get them a glass of water, turn the blinds, turn the air, turn the heat, that type thing. So if I were to walk, or any of us walk by a call light, that states that we are not providing a service to that patient's individual need, and that is a form of neglect. So as I said before, it's a responsibility of everyone in the center to answer call lights. We look very forward to working with you, and I've enjoyed taking this time. If you have any questions, my office is in the front lobby, and I'd be happy to answer anything in depth that you may have. Welcome to NHC.
Hi, my name is Brian Morehouse, and I'm the administrator here at NHC Greenville. As a sitter, we know that you're going to be part of our care team, and even though you're employed by the family, we find that it's very important that you understand what to do in the event of an emergency, and the state requires that we train you on our emergency procedures. So, today we want to spend just a few minutes to walk you through what to do in case of a fire. So I'm here on the nursing unit, and I want to walk you through with what we do and what we call RACE, R-A-C-E. We're going to start with the R part of it, and R is for rescue the patient. So let me give you a scenario. Let's say that you're the sitter in this room, and you go to get your patient a drink of water, you come back down to the room, and you notice that the air conditioner is on fire. The first thing that we're going to do in this room is you're going to R, rescue the patient. So we're going to want you to go in the room. You're going to get Mr. or Mrs. Jones, and you're actually going to get them out of the room, because rescuing the patient, as patients are a priority, to get them out of that room is the first thing we've got to do. Now, the other thing we're going to do is, if there are other patients in that room, we're going to make sure we rescue those patients as well. So if you have another patient in the bed, we want to make sure we get them out of the room, and then we are going to go through and we check the closets, we check the bathroom, we check the shower to make sure nobody else is in that room. And that's the R part of rescue. Now, the second thing we look at is A, which is activate the alarm. And our code word for a fire is code red. So again, for a fire, our code word is code red. So as you're going in to rescue that patient, you're going to be calling out code red and the room number. In this case, it is 222. So I'm going to be calling out code red 222, code red 222, taking those patients out of the room. And that's how we, A, activate the alarm. And then the third thing in RACE is close the doors and contain the fire. And the way we do that is, very simply, we close the doors. That keeps the smoke and the fire in the patient's room. And then probably the last thing we'll need for you as a sitter is on the inside of every door are two magnets. One of them is a fire magnet. The second one is an evacuated magnet. So what we will do is, if this is the room where the fire is, we're going to put that fire magnet on the door that lets everybody in this hallway know that's where the fire is if they come down here. And then if you've gotten your patient and maybe the other patient or anybody else in that room, we put up this evacuated sign, and that evacuated sign means once we close that door, no one else goes in that room. The smoke is safe, and we don't have smoke penetrating the hallway, which is what kills patients in the event of a fire. So again, let's review. R, rescue the patient. A, activate the alarm, and we do that by calling out code red and the location of the fire, in this case 222. C is close doors, which C contains that fire. And then the last thing we would look at is E for RACE, which is evacuate or extinguish the fire. And really, if you've done those first three steps, our charge nurses and our team will take care of the rest of it. But as, again, a sitter, part of our team, you're going to be expected to at least know what to do that first couple of functions of rescuing the patient, getting them out of the room, closing the door, and getting up our tags. Now, there are a couple of other things that probably you need to know when it comes down to addressing a fire. So let's cover, first of all, what to do with a fire extinguisher. Again, RACE, rescue the patient. A, activate the alarm. C, contain the fire. And E, evacuate or extinguish. In some cases, you may be able to get to that fire, put it out quickly without having to involve everybody. And if you can put it out quickly while still, after you've evacuated that patient, we do allow you to do that. That's your call to make, but if there's any question, patients always come first to get them out of the room. In the event that you do want to extinguish that fire, we have down the hallways this red fire extinguisher sign. So as you look down the hallway, you look for one of these signs, and in this cabinet, you'll find the fire extinguisher. Now, this is an ABC fire extinguisher. It will cover any fire that you come across, and when we do fires, we let our staff know what we call the PASS method, P-A-S-S. That means there's a pin right here. You pull that pin out, and once you pull that pin, that makes the fire extinguisher eligible to be used. Then we aim the hose that you use. Then, and I'm not going to do it in this one, but you actually squeeze, which is this trigger right here, and then the next part of pass, or the last part, is sweep. So you point at the fire, and then you sweep back and forth while you're squeezing to put that fire out. All right, the last thing I want you to know about being ready for a fire, again, code red is our code word, is what we call a pull station. In the event that we do have a fire, very simply, you will take this, put your hand over it, look away, push down to break the glass. That will allow you this T-bar right here. You grab that T-bar and pull it down, and that in turn activates our fire alarm system, which will close off the air handlers, activate to notify the fire station and make sure that everybody else in our building is coming to help you to rescue and put out that fire. All right, now, the next thing we want you to know as a sitter at NHC Greenville is that we can't cover every emergency that you may experience here. So at every nurse's station, we have what we call an Emergency Management Plan Manual, or an EMP manual. We don't expect you to know everything in this manual. What we do want and expect for you to know is that if something comes up, you're not sure what to do, you come to the charge nurse at that nurse's station and they can access every policy and procedure in our building as to what to do, how to handle it, and what your role will be in handling that particular problem. All right, the last two areas we want you to be aware of as a sitter is we have a missing patient policy and also what to do in the event of a tornado. Now, occasionally these things come up, so instead of reading the whole EMP manual, we want you just to be aware of how these work. In the event that you think you have a patient who is missing, we want you to know our code yellow is the term we use for a missing patient. Now, here's how it works. Let's say that you're in charge of your patient. You go to the nurse's station to get them something. You come back and the patient is gone. The first thing we're going to do is search the immediate area, the room, the bed, the bathroom, make sure that they haven't gone somewhere there. We search the immediate area, which are other rooms in the adjoining area and ancillary locations. And if you still can't find that patient, you need to let your charge nurse know immediately, and we in turn will call what we call a code yellow, and that alerts everybody in the building to check exits, do a sweep around the building to make sure no one has left or eloped, is how we term that. And we do an immediate head count to see if we can track down that patient who may have addressed or moved to another location. Again, code yellow, missing patient is our policy. Search the immediate area. If you can't find your patient in that short time frame, you let your charge nurse know immediately. The second thing I want you to know is what we call a code gray. Code gray is the term that we use for a tornado. And there are two types of code grays that we use. The first one is a tornado watch. And a tornado watch means that there are favorable conditions that we could have tornadoes in the immediate area. And the second one is code gray tornado warning. And a tornado warning means that we have got literally sightings of a tornado that has touched down, and that is when we begin an evacuation process that I'm going to go through with you very quickly. Again, a tornado warning is the point that a charge nurse will come down, call code gray, and let everybody know in this building. And our job and your job as a sitter is to make sure, again, back to our room 222, we're going to take all of the patients out of the rooms because the concern is that wind could blow things through that room. We're going to close the blinds, which prevent flying objects to come into the room, pull the curtains, and close the patient's door. And then we'll move those patients into the hallway here, and you see these two fire doors right here. We will close these fire doors. We will place patients along the interior wall of our facility. And again, we're keeping them away from glass. And right on the other side here, we've got glass at areas that certainly could be blown into this area. So we're going to take patients and put them where there is not any glass, close to that nurse's station, away from windows and so on. But again, your role as a sitter is just to make sure that you're getting your patients out of the room, assisting, and all these patients will be placed into the hallway behind the fire barrier doors to keep them from glass from being blown and harming them. Now, in the unlikely event that your patient happens to be bedridden, our policies do address that. We do not take patients who are in the bed into the hallways because it creates a traffic jam where we just can't manage patients. So our job then is to leave that door open, to take our patient and actually move them to the interior wall, which is the wall that lines this corridor here, and again, close the blinds, pull the curtains, and then anything we can put that will keep that patient from having projectiles blown on top of them where they could hurt them is the most prudent way to ensure their safety without actually bringing them into the hallway.
I started with Hi, my name is Ernie Wicker. I'm the Director of Nursing here at NHC Greenville, and I'm here to talk to you today about infection control. One of the most important ways of preventing the spread of infection is the use of standard precautions. Standard precautions, basically what that means is that you treat all blood and body fluids as if they are potentially infected with bloodborne pathogens. Here at NHC, we have a written exposure control plan. If you are exposed to any bloodborne pathogens, any spills, anything like that, the first thing you would do is you would report it to the charge nurse on the floor. We also here at NHC, if someone has an infectious disease that you happen to be caring for, we have what's called PPE, or personal protective equipment. This consists of gowns, gloves, masks, and if you needed, goggles. We also have a color-coded system, which is what we use for any contaminated linen and contaminated dressings. The red biohazard bag is what all blood and body products would go into, and the yellow biohazard bag is what all of our linen is put into. If you have any questions about anything for the patient that you happen to be sitting with or caring for, then we encourage you to go to the charge nurse that is taking care of that patient for the time you're here. Also, we do not recommend any open-toed shoes if you are caring for patients and have any direct patient care. This also helps prevent the spread of infection, because if there is a blood or body fluid spill, you don't want that falling on your feet in an open-toed shoe. Should you have any type of exposure, a splash on the skin, in your mouth, your nose, or your eyes, then first aid is what you need to take care of first. If it's on the skin, if it's in your mouth or your nose or your ears, then you would flush that immediately with water. If it's in the eyes, on every unit we have flush stations, eye wash stations, and you would immediately flush your eyes out and report it to the charge nurse. The single most effective way to prevent the spread of infection is to do hand washing, and you need to wash your hands after each exposure or direct contact with the patient. Even if you're only caring for that one patient, every time you do something, change a brief, change the bed linens, any of that stuff, you need to wash your hands. And our hand washing policy here is that you go into the bathroom, turn on the warm water, you use the soap that's provided. It's an antibacterial soap. You wash your hands for 15 seconds. Some people sing the happy birthday song, and then you use really good strong friction. You want to do the backs of the hands, the fingertips, the palms, all the way up past the wrists, and then you want to rinse them very thoroughly. You dry them with a paper towel, and then you get a clean paper towel and you turn off the water with that. Again, welcome to NHC. We hope that you're going to have a pleasant experience here sitting with your patients, and of course at any time, if you have any questions at all about infection control, you're welcome to ask one of the CNAs that are caring for your patient. You're welcome to ask the charge nurse who's in charge of that patient, the nurse manager, or myself. Any of us would be happy to help you.